Awesome. Hi, everyone. My name is Eddie Qureshi. I'm the founder and CEO of Rainfall Health. We are a software company that helps health systems maximize their accountability and reimbursement for Medicare. Today, we have an awesome guest, Tametha, who will be able to introduce herself in just a moment. For us, we'll just be going through this webinar today and talking about the CMS Transforming Episode Accountability Model team. And this is an incredibly exciting new model that goes live January 1st, 2026, and is mandated with 740 plus participants. These facilities are selected based on their core business service areas, CBSA codes, paid under the IPPS, and can include safety net hospitals, rural hospitals, Medicare dependent hospitals, as well as leading health systems, and affects nearly every single state except for Alaska. It includes only Medicare Parts A and B beneficiaries and 5 procedure codes. This includes spinal fusion, surgical hip femur fracture treatment, lower extremity joint replacement, CABG, coronary artery bypass graft, and major valve procedure. Now, the tricky part of this model is there's new requirements that puts these managed facilities at the center of patient care enablement and all the care that needs to be provided up to 30 days after the procedures. And there's multiple tracks and multiple reimbursement requirements that are new for this model, which is why we're super excited to have Tametha here to have a discussion around the model and how it affects different health systems. Tametha, please jump in. We'd love to, if you could introduce yourself, and then we'll jump into the core of our discussion.
Sounds good. Thanks, Eddie. Hi, everyone. I am Tametha Stroh. I am an RN by trade, and I work for Kaiser Permanente. I am the Senior Director for National Risk Management and Patient Safety. I have worked in safety, regulatory, infection prevention, quality of care for the last 18 plus years, and very excited about joining this advisory team. I have served as a subject matter expert on several national advisory groups in the past, as well as currently. And it's just, an extension of my passion for safety in this world that we live in, and as part of a healthcare provider. So very excited to be with you today and to understand more about this team model and how it will impact systems from across the United States. And so very excited to be here with you today. Thanks.
Thanks, Tametha. That we're incredibly lucky and fortunate to have you and somebody who's been fighting for so much patient safety, quality over this period of time. From a healthcare system perspective, what are some outstanding questions you think that other executives across these facilities might have about this new model that's going live and it's mandated starting January 1st, 2026? And as we record this, we're here almost midway through 2025.
Yeah, I think with any new regulations that come out, what's important to organizations is to learn exactly the why behind the regulations and what the compliance with them means, what it entails for them. I know for me, when regulations are being announced and coming forward, the first thing that I usually do is put together, something called a gap analysis, where I put all of the requirements down on paper and I perform a current state evaluation. Where does my organization sit in comparison to what's coming down the pike? Are we currently, compliant with the things that they're going to be asking for? Do we currently have systems, structures, processes in place that allow us to meet this criteria efficiently and effectively? And then if not, what are those gaps? And then how will we move forward to ensure that we do comply? And it takes a team approach. It takes, our operations teams. It takes our regulatory teams our safety teams, everybody who's involved with the care that is directly impacted by such measures to really come together and work through that. I definitely live in the proactive world, and so stay very active with things that are, coming down, how they're being developed. I've even participated in feedback to, government and to different organizations as to what that might, mean to an organization. So it's very important for organizations to have a very clear understanding of what is expected of them and then how they can comply with them. So the more information we get, the more details around how it will be observed when government or organizations and accrediting bodies serving on behalf of those organizations come into our world, how do we comply with it and make sure that our patients remain safe at all times. So it's not just about the compliance of it, but it's about really making sure that we're doing it the safest way possible. So,
Absolutely. Um, for your counterparts that might be at these other mandated facilities, and I think you touched on a really important thing, that it's not just one aspect. It's not just accountability. It's actually everything from finance to clinical operations to safety, accountability. This entire swath of experts within each facility and each system that need to come together to have this take place. What are, some things that folks can be doing in their own facilities to help do that sort of team approach? Because you're part of this incredible system that tends to be a thought leader. And, if you have any tips and tricks for folks that are looking to get themselves, in prepared for these changes that are coming down pretty fast down the road.
yeah, I think, one of the most important things is, first of all, communication and awareness. In big organizations, such as mine, there's a lot of people that have to be informed. So you have to have structures and pathways to ensure that all the people who need to be informed, who serve as a key stakeholder in some aspect of this, are kept informed, are brought into the conversation, um, so that they have a voice in what's going to play a role in how they provide care and how our patients receive care. And patients are a big piece of that as well. And so we have patient advisors that serve on our committees. One of our national committees, well, actually many of our committees, but we have two that serve on our patient safety committees, and we go to them and we ask them, what does this look like for you, and what would you like to see? So making sure that communication is the biggest thing, and having those pathways, um, making sure that you have those structures in place that you can get the communication out to everyone that needs to have it, right? And identifying who those people are. So, for me, anytime I'm working on something, I go to my committee and I'll say, this is what I need to work on. Who are the people that need to be brought in? And I build, a governance and oversight structure and a charter for the work to define, who it is. And then I make sure that everybody sees that, to say, do I have all the right people? Am I missing anybody? And so once I do that, then it's about getting everybody together and saying, this is what's coming, this is what the recommendations are, here's the gaps that I've identified, who can I work with, to remediate those gaps that we have in the system. So it's a very structured approach. Um, you know, for Kaiser, we work on a safety framework of accountability, reliability, and resiliency. And so we call that our safety management system. And it's very important to us that we have those structures and pathways in place to ensure that we get the right communication to the right people. And so That's typically how we do it, and that's what would be most important for everybody, because there's usually somebody that this is going to hit that they don't find out about it until after it's already live, and you don't want that. You want to make sure that everybody who needs to be aware of it is well aware of it and can plan appropriately for it before it ever gets here.
Thank you for leading us through that. I, for one, am very glad there's leaders like yourself that are on the forefront of healthcare, because it's a very complex thing, like you're mentioning, the amount of thought that goes into just planning proactively for things while you also have a full-time job making sure all the existing things are being provided. So thank you for all that you do. One of the things to me that really stood out was how important the patient safety and the voice of patients is in these processes. And that's also one of the things that for us here at Rainfall, why team model specifically stood out so much for our core mission around being able to provide better accessibility care, is it aligns these incentives between patients and the facilities in an even more intimate way, where the providers and the facilities really are working even more closely hand in hand with the patients in every step of the process, even post surgery. And I think that's something that's so powerful from a sort of goal perspective that CMS is putting out around accountability for better patient management. Um, and do you also find this is one of those pieces that could have an outstanding impact in how we potentially deliver care in the long term?
Oh yeah. You know, patients need to be communicated in a way that they understand. And having surgery and, going home sooner than we ever did before, and having to care for our loved ones at home, it's a lot. It's a lot. And it, our most family members are not care providers, right? You're lucky if you have a nurse at home or you have a physician at home that can serve in that capacity. But if you don't, it's tough, and so making sure that the patients have the connections that they need to get the care that they need and the timely follow-up that they need. um, Time goes by fast, and if they don't have the right connections, if they start to have complications and they don't realize what the consequence of those complications could be, infections happen post procedures. So any little thing that starts to go wrong, if you can care for it timely, you can have the best outcomes. And so really making sure that the communication and the structure is there for families and patients to understand, what do I need to look for? What do I need to call about? And if I call, will I get in touch with someone? If I need to make an appointment, will I get that appointment? Will I have that access to the care that I need? So I think it's very important, and really making sure that the patients and their family members have those connections for the safest outcomes.
Thanks, Tametha. Um, for such a, looking at the team model, and we put this amazing advisory committee together, the RAIN committee with executives across different systems. And, there's so much focus now being put on this impactful model because it puts in scope some of the largest, you know, uh, kind of procedure codes that tend to affect a lot of Medicare recipients, and they tend to also be one of the more costly procedures that Medicare pays for. And now we're adding in additional follow-up post-acute care as part of the episode as well. A lot of benefits that can come from it, but I'm also curious, what would be some of the outstanding questions that different executives across these facilities might have, and how like, do you take this as just another model because CMS has put out dozens in the past? Or is it each time you have to kind of get intimately familiar with the new scope and requirements and kind of build up from there?
Yeah, each time it's getting to know the model itself and building up from that model.
Mhm.
Um, and you know, I always say that government, government requirements and regulatory requirements don't come from nothing. They usually come from years and years of finding similar things happening over and over and over again. And it's a way for them to try to address those issues. It's not always the right way. It's not always the easiest way, um, but it's something that they've identified as a risk, and they're trying to do the best they can. So it's incumbent upon us to really understand the why behind it, what's entailed in it, and then how we can comply with it, and then how can we expand it, right? So if they're coming from this perception of we need to engage the patients 30 days past after surgery monitoring, how do we expand that for other procedures, right? Not just the ones that they're calling out. So it really, when things like this come out, for me, it gives me a chance to really think differently, like what else might I be missing. Because again, we talk about like near misses, you can get a lot of learning from them, right? So maybe harm didn't happen that time, but if you really look into what happened and how it was missed and what safeguards we had in place that maybe caught it early, how can you expand upon that, and how can you apply that knowledge elsewhere? So this kind of serves in that same capacity. It's like it's coming, we may already be compliant doing this in different pieces of it or whatever it may be, but it just gives us a point in time to stop, reflect, and then see where else we can apply it. So as long as you have that open mindset, and you're always putting the patient first, it'll lead you down the right path. So
Thanks, Tametha. Couldn't agree more. Just in the last minute or so, curious about if you have anything that you want have anything you'd say to folks both on the regulatory side or other mandated participants, because in some ways, because as we said, even at the top of this recording, that it affects so many different facilities, all the way from rural standalone hospitals, all the way to some of the largest health systems in metropolitan areas. Is there anything that stands out to you, or anything, of note for both the regulatory agencies that are impacting and leading this model, and the ones that have to comply with it on the provider and facility side?
not yet. These are still, fairly new to me. So I'm still in the process of understanding them myself, and and trying to help my own organization maneuver through this. So still getting in touch with key stakeholders, and seeing, who's already on this and working on it, and how can I help. But so I don't really have anything yet. Still in that phase of uh learning myself, if you will.
Absolutely. Aren't we all? Especially as we know that this model is going to evolve about at least twice a year for the next 5 years. So I think this is going to definitely be a journey and not a destination that we're aiming for.
Yeah.
Amazing. Well, thanks so much, Tametha, for taking the time with us, and thanks everybody for joining.
Thank you.